Hi, everyone. Dr. B here again, and with Dr. Staci. Thanks for joining us for another episode of Ask the Dentist. And today we are going to start a four-part series. These are small bites. We want to keep this simple. Both Dr. Staci and I are getting bombarded with questions about hydroxyapatite. So we are going to do a everything you've ever wanted to know about it series in four parts. And the last episode, I think, will be very exciting. We have an announcement to make. I think it's going to excite a lot of people. A lot of people have been waiting for this announcement, as well as we have. We've been working on something for a long, long time. And it will involve hydroxyapatite, but we want to just clear the water here on hydroxyapatite. So Dr. Staci and I just wanted to sit down together with you, with our followers. A lot of this will be based on questions that we're getting, right? I mean, what the questions we're getting are the same from our followers, right? We're getting, what is it? How does it work? A safety and efficacy. People are very concerned about Nano, and we have the answers, right? We're gonna just go through it in a very simple way. This will appear on YouTube, so if you have questions, put down your comments below and we will look at that and scan that as well, or reach out to us on Instagram. So how are you today, Dr. Staci?
I'm great. I'm so happy we're finally doing this. We've been talking about this and planning for this and researching and planning more for what seems like a very, very long time, Dr. Berhenna. And here we are.
Yes, and I'm very excited as well. So it's become a very complicated topic, unfortunately, and we're going to try and simplify it. There's a lot of concern about it. Frankly, I think we have a lot of good news in this four-part series.
Yes,
And this is
indeed.
something that we are standing behind. It gets rid of fluoride, but we're going to talk all about that. So
hmm
in the four-part series, we'll start off with what is it? That's today's episode.
hmm
How does it work? That'll be part two. How does it compare to fluoride? That's part of that mechanism discussion. And then number three, a lot of people are going to be tuning into that, safety and efficacy. And then number four, what version is best and what toothpaste should we be using? I mean, what toothpaste do we recommend? It is appearing in a lot of toothpaste now. It's a boutique kind of
Yeah,
product, but it's been around for 40 years.
closer to 50.
Okay.
So the history of it is that it was used for medical applications by NASA. So they were finding they were sending their astronauts up into space and we lose minerals in space. And so they were starting to use hydroxyapatite. And then in 1974, a Japanese company caught wind of this and kind of acquired the proprietary rights. And so that is why we've been seeing hydroxyapatite as the gold standard in many toothpaste in Japan and other countries like Italy since the 1970s, which is really cool. So to many of us, we think this is such a new product, but it's been around, it's been studied, it's been used for decades. And
And
it's biomimetic. It is
right,
from, it is what's in our enamel, it's what's in our dentin, it's what's in our bone. We can get into
it's the
that.
major ingredient. I mean,
Yes,
what makes up all our calcified
97%,
tissues.
97% of our enamel, 70% of our dentin, and 60% of our bone are made of hydroxyapatite,
Exactly.
which many people don't know. And so, as functional dentists, we like to use biocompatible ingredients. We like to use things as closest to nature as possible, and that would be hydroxyapatite because that is what your enamel needs when it is lacking minerals.
Right. And I remember when you said biocompatible, I remember my instructor in dental school. It was a French name, Lagasse, I think. And he
Mm,
talked a lot about biocompatibility, but there's one step beyond that. There's biomimetic. I mean, you can use
mhm.
something that is synthetic or not natural, but it is considered to be biocompatible. But then
Yes.
there's biomimetic, and that's what the micro version, we're going to talk about all the different versions. That's what ground up hydroxyapatite is. It is biomimetic. It's already found in the body. So that's a step up from biocompatible.
Yes, I agree. And a step up from fluoride. And this will be in a later episode when we really get into the nitty gritty. But, fluoride is not found in our enamel. And
Right.
so it really, by using fluoride, it's changing the structure to a
Hmm.
fluorapatite instead of a hydroxyapatite. And many argue that that's actually a weaker form of
Hmm.
our enamel. And so we'll get into that more in future episodes. But
And a less
I
and a less flattering form as well. Uh,
absolutely.
and back to biocompatible biomimetic. So it's not biomimetic. It's not naturally found. If we just have a child grow enamel, and there's no fluoride in there, unless you add fluoride to their diet, unfortunately.
Mhm.
We'll talk a little bit about that as well. And then there's biocompatible. The question is fluoride biocompatible? And there's a lot of news on that as well, including a lawsuit against the EPA. And I think we're going to find that it's not biomimetic. We know that. And it's certainly not biocompatible. But
Yes.
the good news is that we've got something to talk about that can easily replace fluoride.
Yes, and the literature is strong behind it, being a fluoride replacement, if not more efficacious and more successful for patients than fluoride. And I've been personally using it for many years. I know you have too. My whole family uses it, but I've been suggesting it to patients as well for many years. And I can tell you, their teeth look better. They
Right?
are healthier. They're disease stables. And
Less sensitive.
what is that? Is it
Yeah.
what are the other ingredients in their toothpaste that they're using? Is it the fluoride itself? The oral microbiome is so incredibly important, and we do know fluoride is antimicrobial.
Mhm.
And so we don't want to be wiping out these microbes, which fluoride will do. And so I'm excited about it. I am excited about what we unpack because, again, you mentioned there have been a lot of questions and concerns about it. What is it? I heard this from this person online. I read that from this article online, and we've been spending a lot of time getting to the bottom of the research with different types of hydroxyapatite. And that's something we want to talk about today too, are the different types of hydroxyapatite. And there's a micro version and there's a nano version.
And the good news is that there is a lot of research, and it's not just recent. The research spans decades. It's been around a long time. There are some research papers that, on like zebrafish that are being misinterpreted in the nano version, easily outweighed by 99% of the literature on how it's safe and how it works very, very well. But we're going to get into that when we talk about probably mechanism and is it safe. It's kind of weird to be talking or saying that when if it's biomimetic, well, of course it's safe, but we're going to talk about it. It's important. So let's talk about what is, just real quickly, and it's a short conversation because it's so simple. It's
Mm-hmm.
found in nature. It's found in our heads, in our teeth. What is hydroxyapatite? We talked about it, that, as you said, it was 60% of bones. Enamel, almost 97, 98% of enamel. And it's also found in saliva.
Mm-hmm.
Saliva is just loaded with minerals, and the major one is hydroxyapatite.
Mm-hmm.
And that is there for a reason. We're going to talk about efficacy and why that is. We're going to talk about why a toothpaste really should be very similar to saliva. An optimal toothpaste would be reverse engineered saliva. In other words, it would mimic what saliva does, because saliva is the backbone of the oral microbiome, which
Absolutely.
hence then is the backbone of repairing your teeth, your body being able to repair its teeth and withstand these moments of, karyogenic damage. In other words, holes in your teeth and your kids' teeth. But what else?
I like to call saliva Mother Nature's golden elixir.
Yep.
We don't give it enough credit. It's incredibly important
Mhm.
for our health.
Mhm.
Yeah, and so it's a naturally occurring mineral of calcium apatite. And so I explain to patients it's like a mineral toothpaste, if you will, if it's in a toothpaste. It's like a supplement. It has calcium and phosphorus, and it's just an easy way to think of it. It's just we're replacing what's missing with exactly that, what is missing, and we're supercharging or boosting our saliva in the process to do what it's supposed to do. But so many of us now are so mineral deficient
Mhm.
that we need a boost, and we should be doing that in a topical way through our toothpaste, and that's where hydroxyapatite comes in.
Right. And the majority of our oral care products are doing the exact opposite. They're trying to knock down the oral microbiome. They're not necessarily adding the right minerals to saliva. They're altering the pH. Saliva needs a certain narrow range of pH to do its job properly. And for centuries, I think, I was going to say decades, but for centuries, we've been really doing the wrong thing. So
Yeah.
a lot has to be undone. So hydroxyapatite essentially it's a naturally occurring mineral. It's a naturally occurring mineral. It's a form of calcium apatite. And when it's an apatite means it's like a globular structure. It's not just calcium. It is combined with oxygen. It's got a hydroxy group. It also has a negative charge to it. And that's how it works. It works really well because the tooth has an opposite charge. And when they're optimally in the same environment like the mouth, this is something that the tooth, anytime you eat something, you need replenishment of minerals with your teeth. And that's why hydroxyapatite is so wonderful. Again, it's biomimetic. It's not just biocompatible. It is already in our teeth. It's just sitting out there in solution in the saliva, ready to be brought back in. And a lot of the time, and this is how bone physiology works, we're always losing bone cells. We're gaining, not bone cells, but calcium from bone. That's how we get calcium back into our blood. That's how we get hydroxyapatite back into saliva. It's lost from tooth structure.
Yes.
So do you want to lose it to an optimal, form of saliva, or do you want it to be lost in something that is just a mix of chemicals and surfactants and emulsifiers? And the answer is obviously no. So again, it's a very simple compound. It's basically calcium, but in a form with an OH hydroxyl group, hydrogen. It's really something that is found all over the body, and it's found in nature. And I'll just give you a little hint on this. The best version of hydroxyapatite is found in liquid form. It's made in Europe, and it is available in some toothpaste here in the US. Again, you don't want to just add powder to toothpaste, bits of calcium. That's not how it works. That's not how the body does it. It's best to do it how this company does it and formulate it in such a way. So again, you have to add water and get that negative charge to it as well. So that will be what, part 4, part 3, a little bit of part 3, part 4.
Yeah, we're going to cover a lot of it throughout, specifically toothpaste and what we think is optimal to use in toothpaste. But, something to mention too is a lot of these products that we're using, they're actually drying the mouth out as well. And that's affecting saliva, which is that nice elixir that we need. And we need these mineral exchanges because, to your point, every time we eat, we do lose some minerals from our teeth. That's natural. And our saliva is supposed to remineralize, but things get out of balance very easily with the modern diet, with mouth breathing, and then with suboptimal products. And so this is where we really love hydroxyapatite to come in, is to balance everything out and keep us in equilibrium.
Right. And of course, in our diet, we can replenish with calcium, and then saliva puts it into that little globular fluid form for us. But of course, that's assuming that you're eating the right foods. And that's also assuming that our current modern diet has enough calcium in it. And we're not talking about supplements necessarily. We're talking about leafy green vegetables, and we'll talk a little bit about that, natural forms of it. But that's what toothpaste is. It's a supercharged, very bioavailable, or it should be, version of a biomimetic, what's naturally found in tooth, a source for this, so that your saliva, it dissolves into your saliva and it's always ready for the tooth when it needs it. And that's pretty much, as you said, after every meal, every snack.
I was going to say it should be, because I don't think many are. I like to think of it as saliva support. I think so many people think of toothpaste as all about freshening breath and removing food. That's what I think most people think our toothpaste does. But it really should be helping with the biofilm and the bacteria, but also with supercharging our saliva, as I mentioned. So we're really excited. We're really excited.
It's not a vacuum cleaner. It's not a disinfectant. It's not spraying, disinfectant on the countertop kind of concept. That does more harm than good. And that actually promotes the progress of cavity formation, gum disease, bad breath, halitosis, any form of oral disease, ulcerations, and we'll talk more about that. So we're going to wrap this up.
Should we talk? Let's talk about micro versus nano. I know you love talking about this stuff,
I'm gonna actually have you talk about it. That's our last bit, because that is part of the definition of what is it. It comes in two different forms. Actually, it comes in multiple forms, but there are two categories. And so we'll go back and forth on that. And then we'll just review what we talked about, and I'll talk a little bit about what's coming in episode 2. So let's talk about nano and micro. A lot of people get confused, including people that are making toothpaste, right?
I agree. 100%.
Yeah, 100%. This is where things get confusing.
So there's quite a few definitions about what the ranges are, actually, because it's a little bit arbitrary how they classify this, and there's rumors that they might be reclassifying what designates a nanoparticle versus a micro. But the most common definition I found was that a nanoparticle, nanohydroxyapatite, are between 20 and 80 nanometers, and micro size are between 5 and 10 microns long. And there are toothpaste brands that use one, or they use the other, or they'll use a blend. Now, specifically, we are big fans of a company out of Portugal called Fluoride Nova. That is a manufacturing facility that's creating superior quality, both nano and micro. You know, a nano paste and kind of a micro powder. And this is what the European SCCS, which is like the FDA, has given a thumbs up to, based on the research they've done, that they're proving that this manufacturing facility and the size, shape, and quality of their particles are safe and efficacious. And so we've dug deep into this. We get a lot of questions about nanoparticles, and this is our next episode is more about the safety and the details of that SCCS ruling and final opinion. But we have concluded, based on all the months of research and talking to experts, that we are loving nano. We're big nanoparticle fans, and I think a blend is wonderful, but to truly fill in microporosities and spots of demineralization and voids, the nanoparticle does seem superior based on the research.
Yeah, and to desensitize teeth, to make them look whiter, smoother, more reflectivity, and also just to give them what they need, instead of putting in fluoride or other agents. There are other ingredients that Sensodyne uses. What is that? It's a potassium phosphate. It's a and it doesn't last because it doesn't stay integrated into the tooth structure. So
there's white papers that are really very well done about sensitivity, and and nanohydroxyapatite really outperforming anything else on the available with sensitivity. So many patients come in. This isn't only for maintenance. This is for, do you have sensitive teeth? Do you have root sensitivity or root exposure? Nanohydroxyapatite is wonderful for that. Do you want brighter, whiter teeth? It will make your teeth look and appear brighter and whiter because it is creating a smoother surface, as you mentioned, how the light reflects. But also, there's a lot of parents that reach out to me saying, my daughter has a cavity that just started. You know, I want to arrest or try to remineralize. What's the best thing to do? And I will tell you, the best thing to use is a nano-based product. It's where I see the most benefit and effect clinically in my practice, and it's what the research and literature is supporting also. Yeah,
the uptake is quicker, it's more effective, it blocks those little lesions that are starting much quicker. So let's talk a little bit, we're going to talk more about this when we talk about the controversy over nano. But so we've talked that there are two categories. There's nano and micro. Micro essentially is a natural form. In other words, it's not synthetic because it's not being manufactured. It's just being ground up, and then it's being put into different formulations in different ways. Again, we like this globular fluid form, hence the name Fluoride Nova, the name of the company. But then there's the nano version, and nano is synthetic only in that they take this natural ground up product and they actually make it much smaller. But
Mhm.
there's more to it. And there's also a discussion about their size, which is what we just spoke of, but there's also the shape of the particle.
Shape.
There's
And
needle, there's rod.
that's
And
really a lot of the big conversation
yes,
is
exactly.
the shape. And we're going to get into that with safety
Right.
coming up. But shape matters, source matters. You know, I think what has happened is people have caught wind, particularly brands, that people want an alternative to fluoride, and so follow the money. So you're seeing a huge explosion in hydroxyapatite. However, I do think people are cutting corners, because I will tell you, quality nano hydroxyapatite is pricey.
Yep.
It's quite pricey, and so to increase profit margins, it's easier to source it maybe from China, or just, you know, other maybe not so reputable manufacturing facilities. And so we need to be asking, there needs to be more transparency among these brands. What are you using? Where is it from? What is the particle shape? What is the particle size? You know, how is it? What's the manufacturing process? And this is where the FCCS has stepped in. And I think it's going to have to come from the consumer, that you need to demand transparency. When I email a company and they tell me proprietary rights, I mean, that's a red flag. We should not be keeping these things from consumers. And you and I, it drives us both nuts when we go on a website to look for the ingredients, and I have to spend 15 minutes finding where they've buried the ingredient list. You know, that should be front and center to the consumer. And so anyway, I just think that's my little rant on transparency. And where this controversy with nano, I think, is really coming from, is that some people were using suboptimal nanoparticles.
Delivery is very important when you're delivering this substance, and we'll talk about that. Some companies do it much better than others. Some of them are patented, the delivery system. Of course, you can't patent calcium, but you can, or hydroxyapatite, but you can patent the delivery system and how it's presented to saliva or in toothpaste. And remember, hydroxyapatite is being used in many other products as well, and has been for a long time. The medical profession uses it. It's used in dental implants and bone growth stimulus, and yeah, it's an amazing product. It's been around for a long time. So we'll talk more about this. We kind of got into it a little bit. It's hard for us to contain ourselves and not get into it, but there will be, and again, by the time you've heard this, please throw us some questions as we go to probably episode 3 and 4. But we're going to talk about hydroxyapatite, big picture. We've started doing that just by defining it. What is it? How do you see it? Is it micro? Is it nano? But there's more to talk about with the nano and micro discussion, and we'll talk about studies.
Yeah. So next time we'll talk about more specifics of how they work, and the differences is how they work, but also how it compares to fluoride. That will be our next discussion, Dr. B.
And then, so in review, we like hydroxyapatite. We're both crazy about it. It is huge news. I guess we have a friend that we both know, James, who I think was the first person to bring nano to the US. Is that right? Would you say?
I mean, the first brand that brought awareness to it, at least. Yeah.
And that was, of course, Boca. Boca, which is now owned by a corporation. But kudos to that. And so Boca has been out, and we both have recommended Boca for probably, what, 4 years now? 3 or 4 years?
I use Boca. That's what I use. I think it's one of the best on the market currently. Yes.
Right. It's not perfect, but more on that later. And then Risewell came to market as well. We'll probably get messaging from Risewell saying they were the first, or Boca, I'm not sure. But anyway, those are the 2 major brands. Everyone knows that. We've recommended it. And I just want to say to them real quickly, thank you for bringing it to the market. We need choices.
Thank you.
No one's going to take on Crest and Colgate. They own the market. It's crap. It actually is bad for us. It causes oral disease and systemic diseases. We're not going to get into that. You've heard us talk about it before, but it's great that options do exist, and more options are coming. So it's wonderful. We want to educate you and let you know what these options are. So in review, we found that Hydroxyapatite is natural, it's biomimetic, it's found in nature, it's found in our bodies, it's found in bone and teeth. In fact, it's one of the major components. It is the major component. It's been around for 40 years. It comes in different particle sizes. That's kind of where it gets complicated. And that's the only area that there is some controversy, but not all nanoparticles are the same. And we're going to talk about that. And then in the next episode, we're going to talk about how does it work? In other words, what is the mechanism? We're going to talk about critical pH. There's a certain pH that it works better in. We're going to talk about remineralization and demineralization, ionic integrity. That's kind of a new concept that we've been kind of bouncing around. That has to do with the amount and type of minerals and I guess the vitality of saliva when it comes to mineral content and the availability of it. And then we're going to talk about whitening, sensitivity. That's more about how it works. And then what is the therapeutic dose? And there is some controversy there. Unfortunately, a lot of all the new brands that are coming into the market now are making some claims that I think are very unreasonable, very deceptive. And so we'll talk about that as well. That science is pretty clear. So we're going to make it very simple for you. Anything else you want to add?
Just that we'll unpack it compared to fluoride. I think it's a big question people have. They're worried about switching to it. And, we've been conditioned to think we need fluoride, we need fluoride, we need fluoride. And we're going to talk to you about why we disagree with that.
Exactly. Good stuff. Yeah. Good.
Great.
End of part one.
So fun.
What is it? We kind of got into the weeds a little bit, but
All
that's
right.
normal for us.
Always a pleasure.
We'll see everyone
see you at part 2.
Thanks for your interest in all of this. We will see you then.
Thank you.
Thank you.